Dr. Quinn, can you define comorbidity and how it relates to COVID-19?
Most definitely. I mean, comorbidities, this includes a scenario where an individual has one or more medical conditions co-occurring with a primary medical condition. And in this case, we're talking about COVID-19 infections as that primary medical condition. The more comorbidities or other medical conditions a person has, the worse they have as far as having a good chance of recovering with minimal effects. Now, there was a recent study in the Journal of American Medical Association, and in this study, they studied individuals in New York that got very, very sick after contracting this COVID-19 infection. I mean, they got so sick that they had to be hospitalized, and some of them lost their lives. And what they noted was 94% of these people that got so sick after getting the COVID infection, they had comorbidities. And the most common comorbidities were hypertension, obesity, and diabetes.
What about people who manage their high blood pressure through medication? Do they need to be extra careful in the age of COVID-19?
Most definitely. I mean, in this article in the Journal of American Medical Association, it talked about if you have a comorbidity, it's really, really to your advantage to manage it the best you can. And what that means is if you have high blood pressure, take your medication with 100% compliance and follow up with your doctor's advice. And also, you want to implement healthy lifestyle decisions such as exercising and eating healthy. And if you do this and if your comorbidity is well controlled, well, if you get the COVID-19 infection, you have a much better chance of a better outcome. And in some cases, you can spare your own personal life.
Dr. Quinn, gyms are for the most part reopened. I know we're both happy about that in Mississippi. What role can exercise play in the fight against COVID-19?
Well, first of all, I am so happy the gym is open, but it's so important that you find a gym that's responsible, meaning they employ responsible protocols like my gym, the Club of Township in Ridgeland in the Renaissance. They check everyone before you come in and make sure that you're not sick. The staff wears masks and gloves. We practice social distancing in the gym, and we keep everything as clean as possible with sanitation before and after each workout. And in that event, you're in an environment that's as safe as possible, and then you can go ahead and employ those healthy lifestyle choices such as exercising every day. And like I said in the article, it talked about controlling these comorbidities, and that way you have a better chance of a safer, healthier lifestyle, especially if you get this COVID-19 infection.
Okay, so work out, but do it as safely as possible. It'll pay off in more ways than one.
Most definitely. It can pay off where it could actually save your life.
All righty. Thank you, Timothy Quinn, practices family medicine up in Ridge. And we do thank you for spending a little time with us, Doc. You're watching 12 News at noon.